Good afternoon. Thank you for joining us. I will start with the usual daily report on the COVID statistics. The total number of positive cases reported yesterday was 222. That represents 6.9% of people newly tested and takes the total number of cases to 27,798. The full regional breakdown will be available later as normal, but I can confirm that of these cases, 54 were in Lothian, 53 in Greater Glasgow and Clyde, and 37 in Lanarkshire. The remaining 78 are across 9 other health boards. Now, I do want to immediately add a note of caution around these figures, as you will have spotted. 222 is the lowest number of new cases we've seen for some time, and to be frank with you, this is a lower number than we would have expected to see today. It is likely to be a weekend effect. Indeed, reported cases on a Monday, as you will recall in weeks gone by, are often lower than on other days. However, just to be sure, I've asked Public Health Scotland to check that there are no other issues that may have impacted on the reporting of the figure today. I can also confirm that 122 people are in hospital, which is an increase of 17 from yesterday, and 16 people are in intensive care. That's 4 more than yesterday. Now, I want today just to draw attention to these hospital and ICU figures, because I still occasionally hear some people say that the rise in cases that we've seen in recent weeks is nothing to worry about because the number of people in hospital is not rising as steeply. And I certainly concede that it's not as high at this stage as it was earlier in the year, and long may that continue. We don't want it to see it go back to those levels. But the number of people in hospital is rising, and nobody should be under any illusion about that. On 15th of September, which was the day we changed the definition of a COVID hospital case to make it more accurate, we reported 48 people in hospital. Today, less than 2 weeks later, the number I've just reported to you is 122. So you can see the rise that has taken place. And back then, on the 15th of September, 6 people were in ICU, and today that number is 16. Now, I don't say this to alarm or worry people unduly, but I do say it to, I hope, make everybody realise that we have to take this rise in cases seriously and do all of the things that are being asked of all of us to try to stem that rise and bring COVID back under control. Because just as was the case earlier in this year, not getting COVID back under control will result in lives that are lost, and none of us want to see that. Finally, though, in the last 24 hours, I can confirm that no deaths were registered of patients who first tested positive over the previous 28 days. Again, though, a caveat on that number: registration offices are right now closed on Sundays, so we would not have expected to see deaths registered yesterday. Since the last briefing on Friday, though, 2 additional deaths have been registered, and the total number of deaths under our daily measurement is now 2,512. And again, that total serves as a reminder of the impact the virus can have, as I have just been saying. And I want, as usual, to pass on my condolences to everybody who has suffered bereavement. The main issue I want to update on today is the guidance we issued last night for students. But before I do that, I want to say a big thank you. It's clear that the vast majority of university students over the weekend stuck to the rules on not meeting other households indoors, and in addition to that, followed the advice on staying away from pubs and cafes and restaurants over the weekend. Sticking to guidelines like that isn't easy, especially in the early days of a university term, but it will make a difference. The incubation period for this virus means I am absolutely sure that we will continue to see increased numbers of infections amongst students for several days to come, and there will always be a need for vigilance. But the responsibility that has been shown over the past few days will help our efforts to stem this spread, and I want to say thank you for that. Yesterday, as I indicated on Friday that we published new guidance for students who might be thinking about returning home from student accommodation. That guidance has been developed in consultation with the National Union of Students in Scotland, Universities Scotland and others, and essentially offers some additional advice on how the rules should be applied in 3 different scenarios. Firstly, where a student wants to return home for a short visit. Secondly, where they might want to return home while self-isolating. Or lastly, where they might want to return home on a more permanent basis. For any students thinking about returning home for a short visit, perhaps at a weekend, the key thing to remember is that if you have formed a new household within your student accommodation, you cannot stay overnight in another household. Unfortunately, that includes your parents' home. However, this is the same rule that applies to all of us just now. It is not a rule that is particular to students. So like the rest of us, you can only meet your parents or carers or other family members or friends outdoors or in a public indoor space, such as a cafe. There should be no more than 6 people in total in the group from no more than 2 households. There are, of course, possible exceptions to that, for example, if you have caring responsibilities or for childcare. And of course, a family emergency, such as a bereavement, could also constitute reasonable grounds for visiting indoors. However, in general, our rule just now for all of us is that we should not meet other households indoors. Now, I know these rules are tough, and they're tough for everybody, not just students, but they are necessary to reduce the risk of the virus spreading between different households. The guidance, though, also provides advice for students who are required to self-isolate, and wherever possible, students who are self-isolating should stay within their student accommodation. That is the best way to stop the virus spreading and the advice we give. If you require support, please first of all contact your college, university or student accommodation provider, because they are there to help you and they have a responsibility to do so. Further information on support available can be found at the Student Information Scotland website. We recognise, though, that even with support in place, some students will feel that they need the help and care of a friend or family member. That might be for reasons relating to physical or mental health or finances. And if that is the case, then you can move to another household to complete your self-isolation period. But I would caution that this is not a decision to be taken lightly. If you decide you absolutely have to move to your family home to self-isolate, you should avoid using public transport. And crucially, the other members of your new household, that's your mum, dad, brothers, sisters of all ages, will have to self-isolate for 14 days from the time you arrive home. Because we can't afford to have the virus spread throughout the country, so it is important that you think about the impact of returning home to self-isolate. I know these are really difficult choices, just like those all of us face every day in this pandemic. Self-isolation is not easy in any circumstances, and I know it can be especially difficult sometimes in student accommodation. As I've made clear, therefore, our default advice is that students should stay in their accommodation while self-isolating, if at all possible. But for students who need to move to another household, I hope that this guidance provides some additional clarity on how this can be managed as safely as possible. Now, the final set of circumstances covered by the guidance is for people who want to return home on a longer term basis. In other words, people who want to stop living in their student accommodation and move permanently back to their parents' home or to some other household. If you are thinking about doing this and are currently self-isolating, then the rules on self-isolation that I've just spoken about still apply to you and all members of your new household. More generally, though, for anyone who is considering this step, we would encourage you to think about how it might affect your access to in-person learning if your college or university is providing this. I would also advise that you consult your college or university to discuss your decision, and you should also think about whether it's something you want to do now, or if it might be better to take a few more weeks before making such a long-term decision. Now, the final point I want to mention in relation to students is, and I understand why this is the case, many students are already concerned about Christmas. So don't assume that the rules in place now for home visits will still apply over Christmas. We review the rules every 3 weeks. And that's why we cannot provide specific guidance for Christmas right now, because that will, of course, depend on the future course of the pandemic. But I want to be very clear that it is absolutely our priority to make sure students are able to return home for Christmas, as I know everybody will want to do. Now, overall, as I mentioned, this guidance has been developed in consultation with student representatives, and essentially, in very difficult circumstances, it is trying to strike a balance. We want to encourage students to remain living in their current accommodation where possible. We believe for many students that gives them the best chance over the course of the term of benefiting from some in-person learning. It also provides the best opportunities, despite the restrictions we're all living under right now, of building new networks and making new friends. However, we know that many students are understandably struggling at the moment. It's tough not being able to see your family at home at a time like this. So the advice tries to explain the circumstances in which there is some flexibility and what factors we are advising you take into account before taking these decisions. The guidance is available on the Scottish Government's website. If you want to look at it in more detail, I would encourage you to do so. But I hope it helps students to make the choices that best reflect their own health and well-being. And finally, on this point, we will continue to update and develop guidance on all aspects of the pandemic where we think that is possible and responsible. This is an inherently volatile and unpredictable situation. So, in my view, government should always try to be flexible, and we should always be trying to learn from experience rather than get stuck in fixed positions for fear of being accused of changing our position. So we will continue to look carefully at guidance, build in as much flexibility as we can as we go through this difficult situation, and make changes where that is possible. And finally, I want to stress again that the reports we've heard over the weekend suggest that the vast majority of students have coped well in really difficult circumstances and have complied with guidance, which would have seemed unimaginable even a year ago. I don't underestimate how tough all of that is, and I am hugely grateful to students for the way in which you are helping us all in our efforts to tackle COVID. And as well as thanking those students who stayed in this weekend, I want, before I conclude today, to thank all those who respected the new rules on hospitality. I know the police will be publishing some figures on their activities over the weekend, over the course of today, but there were relatively few reports of any public health or public order difficulties around the new 10 p.m. curfew time. And I think that's a reflection on the levels of cooperation we've seen from hospitality businesses and customers across the country. Sticking to these new rules will be crucial in helping us get this virus back under control. So I want to end, as I usually do, with a thank you to everybody, but also a run through of the current rules and guidance. With some limited exceptions, none of us right now should be visiting each other's homes. When we do meet other households, outdoors or in indoor public places, we should stick to groups of a maximum of 6 people from a maximum of 2 households. Young people aged 12 to 17 are exempt from the 2 household limit. As long as they're outdoors, they can meet in groups of up to 6, but should still physically distance. And outdoors, children under 12 are not included in these limits at all. They can play with their friends without limit outdoors. In addition to these rules, there are other steps all of us can take to help reduce the spread of the virus. We should, all of us, think about limiting our visits to and social interactions in places like pubs and restaurants. We should work from home if we possibly can, and employers should facilitate that where possible. We should all download the Protect Scotland app if we can. And finally, we should all remember and abide by facts. And that's face coverings in enclosed spaces, avoid crowded areas, clean hands and hard surfaces, keep a 2-metre distance from people in other households, and of course, self-isolate and book a test for COVID if you experience any of the symptoms. If we all follow these rules, difficult though I know it is, we will, over these next few weeks, stem the increase in cases and bring this epidemic back under control in Scotland, which I hope then will allow us greater freedoms again in the not too distant future. So my thanks again to everybody for all of the sacrifices I know you continue to make. I'm going to hand over now to the Chief Medical Officer, who's going to say a few words about mental health support, really important in these difficult times. And then, of course, we'll take questions from journalists as normal.
Thanks, First Minister. So today I want to speak a little bit about mental health and wellbeing support that's available across the country. We know that the introduction of new restrictions is tough. It shows that the road to recovery from this virus will not be as straightforward as we all hoped. But one thing that has been consistent over the past 6 months is the fundamental importance of how we all feel. Keeping healthy has not been easy at times, and that applies to both physical and mental well-being. During the pandemic, we have seen a renewed focus on mental health throughout Scotland. This has been really tough for lots of us, and that has meant there have been more conversations about mental health and well-being. People across the country have been asking each other how they are feeling. I hope that all of this means that more of us know that it's okay to ask for help if we need it. So I wanted to briefly mention some of the sources of support that are out there and accessible just now. Earlier this year, we launched the Clear Your Head campaign to support you to take care of your mental health and well-being. You can find it at clearyourhead.scot. I would urge anyone who feels in need of some useful tips to support their well-being to visit this website. And we're expanding the NHS 24 Mental Health Hub so that it's now available 24 hours a day, 7 days a week. You can reach the hub by dialling 111. We also have expanded the capacity of the Breathing Space telephone helpline and web support service, a service which we know has experienced an increase in call demand during the pandemic period. And this service you can access by dialling 0800 83 85 87. It's worth saying that these sources of support are available for everyone, including students too, if they should need them. But today I also wanted to specifically say something about mental health and wellbeing support groups that we find round about us in our communities. The work of these groups has never been so critical. Community support groups are vital for so many people who might need that additional help for their well-being during this time, be that mental health or more generally. We've received lots of queries from groups across Scotland to provide these services. They've been asking us whether they're allowed to operate given the current restrictions, and especially following the announcement of new measures this week. So for clarity, I wanted to outline the current position now. Mental health and wellbeing support should, in general, be provided remotely where that's possible. This is in line with the Scottish Government guidance that remote working should be the default position. However, if the use of technology would not result in the same benefit of face-to-face meetings, then support can be delivered in person. The guidance from Health Protection Scotland, for example, relating to physical distancing, the use of hand sanitizer and so on, continues to apply in these circumstances. It's the purpose of the meeting that's important here. People who are coming together for care and support is okay. However, it's important to stress again that other relevant rules continue to apply. For example, you may have to change the layout of a room to ensure that there's adequate physical distancing and make sure that the ventilation of that room is adequate too. We can all play our part in looking out for each other just now. Even just asking people how they're doing and giving them the space to talk openly and honestly can help reduce a sense of isolation and help people seek support when they need it. Try and do it in a way that removes distractions. Show them that you're really listening. And try to use open questions rather than ones that invite a yes or a no answer. And if you can't be with them in person, a text, a call, or a video message can sometimes make the world of a difference. I'm very grateful to all those providing support across the country. The work you do is vital, and the way you go about it is an inspiration. It's not easy work, but you're making a real difference to people's lives through the mental health and wellbeing support that you're providing. So I wanted to say thank you. I hope this provides some clarity on how people can seek support from you when they need it.
Many thanks, Gregor. We'll go straight to questions now. Jamie McIver from BBC.
Hello, good afternoon, First Minister. Looking at students, how concerned are you about the potential for large numbers of students to return home just now, potentially adding to the spread of the virus? And given all the pressures students are under now, are you concerned that a greater number than normal may drop out of university completely?
On the second part of your question, it is a responsibility we all have collectively, but obviously universities are in the front line of this to make sure students get the support they need through a difficult period in order to maintain their studies. And I would stress that very much. We don't want to see students unable to maintain their studies because of the added pressures that everybody is going through now because of the pandemic. So universities, I would encourage not just to look after the welfare of their students, but also to be understanding and be in dialogue with students who might be struggling academically because of this. Obviously, all of us, in everything we're doing right now, we have to be mindful of the need to stop this virus spreading from one person to another. one household to another, one part of the country to another. That's why all of us right now, not just students, but all of us are living under quite significant restrictions in how we can go about our everyday lives. And students have to be mindful of that as well, difficult though I know it is. What we're trying to do here is strike a balance. So as I've said clearly today, and this reflects the guidance that was published last night, our advice is where possible, stay in your student accommodation. Self-isolate there if that's the advice you've been given, and if you're not being asked to self-isolate, stay in your student accommodation and carry on with your university education in that way. But what we're trying to do is recognise, as we do in everything around handling of the virus, is recognise the human impacts and the difficulties people will face. So we are trying to build in some flexibilities and give advice about what should happen in circumstances where that default advice cannot be followed. So we're being pragmatic here, and particularly where a student is self-isolating, while our advice is to do that in the student accommodation, if for the reasons I set out they simply cannot do that, then we are being very clear about the precautions they should take. So in travelling home, don't use public transport, minimise the risk that you'll come into contact with others, and this is a very, very important part of the advice that I have to be clear about. If you are self-isolating because you have been exposed to the virus and you go home to your family home, the other members of your family there must self-isolate. And that's for a 14-day period from the point you go home. Because if you have the virus and you're incubating it and you pass it on to them, that self-isolation avoids them passing it on to others. So we're trying to be pragmatic here, and that runs through everything we're doing. But fundamentally, we have to take precautions that stop this virus spreading, and that's the difficult balance we're trying to strike. And we will continue to review, whether it's with students or any other aspect of life, whether we've got that balance right and whether we need to make modifications. The worst thing any government can do right now, while it's our responsibility to give clear advice, is not to try to learn from experience and make changes where the evidence tells us that is required. Gordon Cree from STV.
Thank you. I'm at Glasgow University, where today we're seeing food parcels being handed out to students, flats who are isolating, and welfare checks have been made. To what extent do you welcome this more supportive approach to the somewhat confrontational tone some students feel that some institutions had in the last few days? And more generally, over the summer, a narrative kind of built up, aided in part by your undoubted clear and regular communication on coronavirus, but a narrative kind of built up that Scotland was doing much better than the rest of the UK on this issue. But in recent days, looking at the data, the curves and things appear to be much the same across the whole country. So why that difference between perception and what the numbers seem to suggest?
Okay, I very much welcome the steps universities are taking to provide support and welfare for students, and as I said on Friday, I had a conference call with all university principals on Friday to stress the importance of that approach, and I welcome the steps that different universities have taken. I welcome the steps that Glasgow took over at the weekend, not just to make sure that students had the support they need in practical terms, but also the moves they made around rent rebates and some financial support. And I would encourage all universities to continue to have the needs of their students absolutely at heart. And I believe universities do have the needs of their students at heart. And as I've also said, and this, I suppose there's a similar issue here when we talk about enforcement on the part of the police. I want to make sure that we are all, as far as possible, pulling together and doing the right things for the right reasons here. The health and well-being of all of us depend on all of us coming together in that spirit of solidarity. So my approach has always been and always will be on encouraging and persuading people to do the right things and to set out the rationale for that. There has always got to be a backstop of enforcement, or in the case of universities, discipline for the minority. And I believe it is a small minority who will not do that and who insist on flagrantly breaching the rules. And that has to be there, because anybody who is flagrantly breaching the rules are putting other people at risk. So it cannot simply be tolerated, and we can't simply shrug our shoulders around that. But I absolutely believe in every aspect of this that the focus and the priority should be on all of us in that spirit of love and solidarity that I spoke about last week and continue to speak about, coming together to do the right thing for ourselves and each other. And on the second part of your question, over the summer, it wasn't a perception, it was a reality. We, because of the particular route we took out of lockdown, we suppressed the virus more than in some other parts of the UK, and infection rates were very low. And notwithstanding what we're seeing now, never think that was a waste of effort. It wasn't, because if we hadn't done that, the resurgence as we come out of lockdown, as we go into winter, as we have some of the issues that I will talk about in a minute, if we hadn't done that, we would have been dealing with that on a much higher threshold. So the challenge, difficult though it is right now, would have been even tougher. And in terms of some of the issues, I don't think Scotland is doing particularly less well than other parts of the UK. All parts of the UK right now are dealing with a resurgence of coronavirus, just as much of Europe is dealing with a resurgence in coronavirus. There are particular things that in Scotland we have had to confront earlier because of just differences in our pattern and timetable of education. Scottish schools went back earlier than schools elsewhere in the UK. So the impact on transmission that would have come from that would have kicked in earlier in Scotland. So some of that is just a feature of doing certain things earlier than other parts of the UK. But the one overriding message I would want to give people is this is an infectious virus. We don't have a magic wand to make it disappear. We suppress it by doing things, and we allow it to spread by not doing things. We couldn't stay in lockdown forever. We have to come out of lockdown for lots of other reasons, and we can't stay in summer forever, even if Scottish summer doesn't feel that different to Scottish winter a lot of the time. So we were always going to face a more challenging period towards the back end of the year, and that is what we're facing right now. But what I would encourage people to remember is that through our collective efforts, we did beat it back in the summer, and through our collective efforts, we will beat it back again if we all do the right things, and that's what we've got to hold on to and remember. Do you want to say anything about transmission patterns?
Yeah, I'm quite happy to. I mean, first of all, thank goodness people stuck to it the way they did during the summer, because if they hadn't done that just now, the situation we'd be faced with just now would have been so much worse. If we had gone into this period of autumn and winter with a much higher disease prevalence in the community just now, as soon as R starts to rise again, that rate of growth acting upon that larger disease pool would have seen much higher case numbers than we're seeing just now. So all that effort is paying its dividends at this point in time. And when we look across the UK and the different disease profiles that we're seeing in terms of the epidemiology that's there, I don't think Scotland is that far behind. I think that the kind of the situation across the UK are showing comparable incidence rates across the country. Perhaps Scotland's still a little bit lower than other countries, but as I say, I don't think that there's weeks between the countries in any sense at all. If you look at the current incidence rate per 100,000 people in Scotland, it's around about 40, and there's marked geographical variation across England in that same figure, and also in Wales and Northern Ireland. So they are broadly similar if we're just a little bit behind. We've had to contend with the return of schools and then the return of students to higher education and further education. And inevitably that has put pressure on a number of cases that we are seeing. And we have had a rise in cases as a result of that. I think it's likely that we will see similar rises in other parts of the UK as their student populations return as well. But hopefully, as we begin to see the effects of the new restrictions that we put in place last week, we'll start to see that case incidence figure starting to come under more control, and we'll start to see a better sense of the kind of true prevalence rates across the country in the general population.
Thanks, Gregor. Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, yesterday Professor Mark Woolhouse told Andrew Marr that it was inevitable there were going to be rises in cases amongst the student population. It was predictable and it had been modelled. Now, he's on one of the scientific advice bodies. Today, your Minister for Higher Education, Richard Lockhead, said, "I don't know what he's referring to." So did the Scottish Government know about this modelling? If it did, should it have done more to prepare along with the universities for this potential rise? And if it didn't, why did it not know about this potential rise amongst students?
Firstly, in terms of Richard Lockhead's response, often, and I say this frequently here, when something is put to you, you don't necessarily know exactly what is being talked about. I now think I do know what Mark Woolhouse was talking about, and if I am correct, it was some work that was done by Bristol University, and the sort of recommendations or suggestions that came out of that work were the things that we then incorporated into the guidance that was published for higher and further education. So we took account of that in the guidance that was established and published now, 2 or 3 weeks ago. I think that Bristol University work came some time earlier in September. SAGE also did some work around further and higher education. Again, that work was incorporated into the guidance that we published. So we do take account of all of these things in coming to the decisions we do and the mitigations that we put in place. So that guidance incorporated the kind of mitigations that were being talked about in both of those exercises.
So the evidence that Mark was referring to is only one of a number of pieces of evidence that comes from around the world in terms of the experience with higher education returning. And you can look to examples in North America and across Europe as to the impact that that's had. All of these pieces of evidence were considered by the relevant groups as they were developing their sectoral guidance as to how to kind of reduce the risk that were associated with that return of students to higher education. And the final guidance that was published, as the First Minister says, 2 to 3 weeks ago, was broadly aligned with most of the recommendations that I certainly saw from the Bristol paper Mark referred to.
Alan Smith from Bauer.
Thank you, First Minister. Just in regards to students, the National Union of Students has said that anyone who chooses to end their accommodation contract and return home should be fully refunded. Is that something you agree with? And secondly, in regards to police activities over the weekend, they've just released a statement saying they attended at least 300 house parties across the weekend, issued 101 fines and made 14 arrests. So I was just looking for a response to that figure, and if you're frustrated that there are still people out there who continue to ignore your warnings.
On the first part of your question, we set out in the guidance last night the provisions that are in place in the coronavirus legislation that would enable students to terminate contracts for accommodation. Obviously, there is a wider legal framework there. Generally speaking, these are, of course, issues between students, universities or accommodation providers, but as a statement of general principle, don't want anybody to be financially disadvantaged because of the circumstances beyond their control. So I would encourage universities and accommodation providers to be as flexible as possible with students who are in that position. In terms of the police figures, I suppose the first thing to say before I do come on to what will probably be a note of frustration, particularly about the 300 house parties that police were called to attend, which I understand was between Friday and Sunday morning. These figures have to be seen in the context of a population of 5.4 million people. So let's first of all put it in perspective. The vast majority of people in Scotland, in my experience and from the anecdotal evidence and harder evidence that we get, are abiding by the rules, and they have my deep appreciation for that. But anybody who's not, and particularly anybody who is flagrantly breaching very clear rules against house parties, should really take a look at themselves, because we know that house parties are one of the risk factors that can cause this virus to spread. And then if a virus spreads through people at a house party, or house gathering perhaps is a better description, because I think when you say house party, people think of, events with dozens of people there. This could be a smaller number of people, but with different households mixing. And they can become almost kind of super spreading events. So that's why we don't want these to happen right now. And I would appeal to people, this is not for, the sake of it that we're giving this advice and putting these rules into place. This is for the collective well-being of people across the country. So if you found yourself having a gathering against the rules at the weekend or a house party, then take a long hard look at yourself, because you're putting yourselves and others at risk right now. One of the things I wanted to point out, though, because I think the police have pointed this out, or certainly I know it is the case, is that it is not the case that all of these 300 house parties or anything like it were students. These were incidents that the police were called to that span the age spectrum and everything. So again, don't any of us think this is all a problem of students. This is about all of our responsibilities. So please abide by the rules. And for people who don't, the police will take action. 101 fixed penalty notices were published. I understand there were 14 arrests over the weekend in relation to these breaches. So there will be consequences, but I don't want people to be always forced to do the right thing because of the consequences. I'll come back to what I said earlier. We all depend on each other right now. We are only as strong as our weakest link in fighting this virus. So let's do the right things for ourselves, for our families, for our communities, and for the country as a whole. There's never been a time when it's more important to act in that collective spirit of solidarity. Phil McDonald from Global.
Thank you, First Minister. With fines for breaking self-isolation coming into force in England today, I was wondering if you had an update on whether the same measures will be introduced here.
I said last week we were not changing the current position around self-isolation at the moment. We keep all of these things under review. But going back to comments I've made earlier on, I want people to be supported to do the right thing, and not for our immediate focus not always to be on punishment for people doing the wrong thing. So what we will set out, as I indicated last week, we'll set out the details later this week of the self-isolation support payment for people on low incomes, because we want to encourage people and support people to self-isolate when they're advised to do so for the right reasons. And we'll be taking steps to make sure people understand how important that is, what self-isolation actually entails, and give the support that people need. There's also work been done involving local authorities about proactive contact with people self-isolating to see whether there's any practical assistance they need to do that. So that's what we're focusing on, rather than a punitive approach. But, as for reasons I've already been touching on, we keep all of these things under review. Katrine Bussey from PA.
Hello, First Minister. I wanted to ask you about the letter that you sent to Boris Johnson last week requesting urgent talks between the four nations on new measures to combat the spread of coronavirus. Have you had any response yet from the Prime Minister? And when could we find out what these new restrictions could be?
As far as I'm aware, I'd need to check back in my office that this hasn't changed over the morning, but I don't think we've had a formal response to the letter yet. Hopefully that will come soon. I said in the letter, and it remains the case, that I'm happy to have a discussion with the Prime Minister, or perhaps more conveniently for him, Michael Gove, to see how we take these discussions forward. The letter, as you know, was to talk about the need to have four nations discussions should we need to take more action beyond what we've taken right now. I didn't put a list of what those actions might be. I see some commentary in the newspapers this morning, I don't know whether it's true or not, that England is already thinking about the restriction on household gatherings that we have already introduced here. But there is a school of scientific opinion that in order to get R back below 1, we may have to do more than we're doing right now. And all I was suggesting was that we, at an early stage, try to see if there is some four nations agreement on what those measures might look like. But the other point in the letter, of course, which is very important, is even if we can't reach four nations agreement, if any one part of the UK feels, because of its data and the spread of the virus, that it needs to do more on its own, we need to make sure there are arrangements in place to ensure that, as would be the case with the Scottish Government, we wouldn't be financially restricted. Now, I'll use the example I've used before, only for illustrative purposes, that if we decided that the curfew of 10 p.m. on hospitality wasn't sufficient and we had to restrict hospitality further, and if the public health advice on that was clear, right now the constraint on the Scottish Government doing that would be financial, because we don't have the ability to compensate or mitigate the financial impacts of that. So we need to have a an agreement and an understanding of how we are all equipped to act on the basis of public health advice and not be held back because the powers over the finances lie somewhere else. So if we, as I hope we will, get some constructive response to that, I will keep you posted. Conor Matchett from the Scotsman.
Thank you, First Minister. Just returning to Peter's question earlier about the modelling from Professor Woolhouse, just an aspect of clarification. Did you personally see that modelling at all? And on students, if I may, did any government ministers or yourself sign off on the guidance published by Universities Scotland last week? And in your mind, was the guidance that was issued considered a request or a ban?
Well, that last part of your question will depend on different parts of it, and I'll come back to that later. I see lots of evidence. I'm aware of the Bristol University. I was aware of the Bristol University work at the time. The mitigations that were suggested out of that modelling, the key point I'm making, was that they were taken account of in the guidance that was published a few weeks ago by the Scottish Government. So it's not, we don't ignore these things. We see lots of pieces of scientific modelling and advice. Some of them, to be perfectly blunt, are contradictory. So we have to take account of all of these. We have our own scientific advisors and we come to balanced judgments. But the mitigations that were suggested as a result of that modelling were taken account of in the guidance that we published. I think I'll be corrected if my memory is wrong on this, but I think the Universities Scotland news release last, if I'm getting my days correct here, they all blur into one at the moment, last Thursday evening, said that the Scottish Government had agreed the key measures that were being put in place, and Richard Lochhead, as the Higher Education Minister, was involved in those discussions. And different bits of them, so the parts of that guidance that said if you are in a halls of residence or student accommodation and you are in a household, then your socialising has to be within that household in your accommodation. That reflects the legal position that applies to all of us against mixing with other households indoors in domestic premises. So that bit is firm because that reflects the law. The other aspect, which I think was the second bullet point in what they put out last week about not going to the pub over the weekend, that was advice and a request on the part of students, because it was believed, and it's still believed, that was important to try to stem any onward transmission of cases. And as I say, all of the evidence, mainly anecdotal evidence that we have, is that students have complied with that. And as I said on Friday, I don't underestimate how tough it is when you're at university, particularly when you've just been started university, to be told not to go to the pub. But we're in a global pandemic right now, and everybody has had to do really difficult things. I know that there are families all over the country that haven't seen their loved ones for months, that haven't been able to visit loved ones in care homes for months. Everybody's having to make sacrifices here in the greater objective of getting this virus back under control. So my gratitude is with students for complying. Do you want to add anything, Gregor? Kieran Andrews from The Times.
Thank you very much, First Minister. In 2018, which is the most recent figures available, suicide was the second largest cause of death in people aged between 15 and 24 in Scotland. I just wondered what advice was taken on balancing the risks to physical health caused by the virus against the risks to mental health caused by the restrictions, given that no one under 30 in Scotland has died with COVID as the underlying cause.
You will recall, and I would refer you, rather than me talk about it at length here, I'm happy to do that, or to give you more written advice, but it's possibly easier if I refer you back to the document that we initially published, I think in April, which set out for the first time the way in which we would take balanced decisions about either continuation of lockdown restrictions or the exit from lockdown. And that was the first document in which we talked about, and we still reference this in every decision we take, the four harms, the different harms that are done by the virus, but also by the ways in which we have had to contain the virus. And therefore we analyse across those four harms and come to balanced decisions. And you know, I'm afraid one of the really invidious things that faces all decision makers all over the world right now is that there's no harm-free way through a global pandemic. Every time you take a decision over here to try to reduce harm in one way, suppress the virus, you do that knowing that you're possibly creating harms elsewhere. And the challenge for all of us is to balance that in a way that we minimise the overall harm that has been done to our populations. And the last point I would make, Gregor might want to say something about this, is I really do, I appeal to journalists, I appeal to commentators and everybody, is not to underplay the dangers of this virus to the younger population. Yes, younger people are far less likely to die from this virus than older people, but the risk of dying is not non-existent to younger people. But there's literally never a day right now where I don't read reports of younger people whose health has been really adversely affected by this virus. They are suffering what's referred to as long COVID, the fatigue, the gastro problems, in some cases heart problems that last a long, long time. Don't underplay that, because if we give young people the impression that there's no risk to this virus, then I think we are doing them a disservice. And of course, any young person with the virus is also always capable of transmitting it to somebody who is much older and much more vulnerable. So we've all got to balance all of the harms, but we don't do anybody any service right now by minimising or underplaying the risks that COVID presents.
So I get very uneasy when I hear people suggesting that COVID's a disease which doesn't have much of an effect for younger people, because the evidence suggests completely the opposite of that. And although we haven't seen the same level of deaths in relation to that age group, what we have seen is a significant level of morbidity within that age group. So younger people can still get really ill with it. They can still end up being hospitalised. They can still end up in an ICU as a consequence of becoming infected with COVID-19. They can have long-term effects from long COVID, and we understand much more about the immune basis as to why that happens now. But we can also have complications from COVID as well because of the way that it acts in the vascular system as well. And I've read case studies of younger people who've had strokes as a consequence of infection with COVID-19 in that respect as well. And the other thing makes me really uneasy as well is as that disease pool increases within younger people, it's inevitable that it will begin to spread into older age groups where we know there are significantly elevated risks of serious illness and of death as well. And if you look at the experience of countries like Spain or France just now, what you can track is that although the infection begins to spread within those younger age groups, it soon extends beyond those age groups and into the rest of the population. And I've got figures in front of me just now that actually demonstrate that we're already starting to see some of that within Scotland just now. For 6 weeks ago, I've got a rate of infection per 100,000 in the elderly. That's roughly about 2 cases per 100,000 in Scotland. And the latest figures I've got from just last week suggest that that's now risen to between 16 and 18 per 100,000. So we're already starting to see that track into older age groups. And yes, predominantly it's the younger age groups that are being infected just now, but it's only a matter of time before we see that spread across those older age groups as well.
Thanks. Simon Johnson from The Telegraph.
Good afternoon, First Minister. I just wanted to return to Mark Woolhouse's comments yesterday that the situation, the outbreaks were entirely predictable. Were you warned about the situation that we've seen at Scotland's universities by your advisors, by your COVID advisors before students returned? And secondly, Professor Debbie Sridhar, another of your advisors, said way back in July that students should be tested on their arrival at university. Was that a view that was expressed directly to you by your advisors as well?
Advisors, whether they express things directly to me, I am capable of reading things that are reported. So I don't know, this kind of idea that I'm somehow standing here trying to pretend I'm not aware of things that scientists and advisors say. I'm aware of all of these things. We take all of them into account. Sometimes this advice is contradictory. Sometimes, one advisor will stress one thing, another advisor will stress another. That's what we do. So to go back to the Bristol University, it said that because of the risks of transmission when students come back, certain mitigations were recommended. We took account of those mitigations in the guidance we published. So, you know, this kind of journalistic, I can sense it coming through the questions today. We've got you, you didn't take account of it. It's not the case. We take account of all of this, and we put in place the mitigations that are necessary. And as we go through these things, if we need to add more mitigations, that's what we do. I have on many occasions standing here and in Parliament, I think I did this as recently as last week in Parliament, went through at some length, probably at greater length than the presiding officer was comfortable with, the reasons that underpin our decisions on testing, on who you test and who that we don't at this stage test. So for international students, for example, the view is that while there is no 100% absolutely guaranteed protection against importation of the virus, for people, students or others coming from higher risk countries, quarantine for 14 days is a more effective protection than testing, because you can test somebody one day, they test negative, but 3 days later, because of the incubation period, they might test positive. So we take account of all of these views and we come to balanced judgments. That's the way these decisions are taken. And, you know, as I say, I read lots from people who are formally in positions of advisor to the Scottish Government and from a whole host of people across the world. I read a huge amount, perhaps sometimes I think too much, opinion and analysis and narrative around what people think we should and shouldn't be doing. But ultimately, governments have to come to balanced judgments, and that's what we seek to do. Chris Musson from The Sun.
Hi, First Minister. Two quick things. There are claims on social media that some teachers have been told to prepare for a circuit break lockdown after the October half term, followed by blended learning. Is this something that you're looking at even as an option? And secondly, you'll be aware that at Westminster, Tory rebels are planning to try to compel UK ministers to put future lockdown regulations to a Parliament vote. Would you consider the same for Holyrood, especially as the SNP Westminster group are considering backing this idea at the Commons?
On the first point, I can't possibly stand here and comment about everything that's said on social media because I can't possibly see it all. But you would know the answer to that question from a parliamentary statement a week ago tomorrow, I think, on when we introduced the tighter restrictions, when I said in terms that we had not taken a decision on a circuit breaker, but we were keeping it under review. So that remains the case right now. I have, as I do every week, as it feels like just now, almost every day, I have discussions later today with senior officials and advisors in the Scottish Government to take stock of the situation and to consider, you know, what options might be necessary for us to take. But at this stage, we have not taken a decision on that. And if and when that changes, I will set that out in the normal way. On the second part of your question, I think this was put to me by somebody in Parliament last week, we want to, in a situation that is fast moving, where we often have to move really quickly to put restrictions in place, of course we want to maximise parliamentary involvement and scrutiny. So we will consider on an ongoing basis the best way of doing that. Right now, parliamentary committees can sit on any day to scrutinise any proposals that are put forward. They're not limited to just sitting on parliamentary sitting days. So we do, particularly 6 months in, we keep this under review and we'll want to talk to parties across the Parliament about how we increase the scrutiny and have as much of that scrutiny as early as possible, albeit recognising that sometimes, because the virus doesn't wait for parliamentary scrutiny, we have to act quickly. Derek Keeley from the Courier.
Thank you, First Minister. I know you said earlier on you're speaking to Public Health Scotland about the kind of relatively low number of cases today. Is there any suggestion at this stage that there is a problem with the kind of data transfer from labs or anything, or is there any suggestion of any problems you're aware of at the moment?
There's no suggestion. On the contrary, I think my early indications are there's no particular problem with, we haven't got a data flow. Obviously, as you know from what we said in the last couple of weeks, we are monitoring very carefully turnaround time of tests. So there's not any particular problem that I am aware of or I am expecting to be made aware of. I've just asked Public Health Scotland for a bit of assurance. My assumption, which is what I drew attention to, is that this is a weekend effect. I think if you go back to Mondays over the course of this, often these figures are a bit lower on Mondays because perhaps people the testing demand is maybe a bit lower, and sometimes the testing processing can be a bit lower as well. So that's why I think it is. If there is anything else that comes to light that would change that, I will report on that tomorrow or in later days. Rachel Watson from the Mail.
Thank you, First Minister. Just on students again, there's been concerns raised by lawyers and legal experts that the restrictions, including forcing them to stay within their halls of residence, is unlawful and breaches their human rights. Is this something that you considered before imposing these restrictions? Do you agree with that assessment? And do you think this needs looked at again? And then just quickly on Glasgow University, you welcomed their decision to refund rent. Is that something the Scottish Government would be willing to help universities with? Will there be extra cash so other universities can do the same?
Glasgow University has done this of its own initiative. I welcome that. We have discussions with universities and others on an ongoing basis, but these are, first and foremost issues for universities. Yes, we consider the law when we pass regulations, as we are obliged to do. The restrictions that are on students, as I said earlier on, the advice over the weekend to stay away from pubs as an additional intervention to try to stem the spread was advice. It was a request that I think most students have complied with. The other advice to students, for example, not mixing between different households within student accommodation, is the same that applies to all of us. All of us are finding our freedoms restricted right now. None of us want to be in that position. But we hope that it will be something that is relatively short-lived as we get this virus back under control. And, ultimately, I think we all take, and I take human rights very, very seriously, but ultimately I think we all take seriously our human right not, if possible, to be infected with a virus that might make us very ill or, in extreme cases, kill us. So we're trying to balance all of these things as carefully and as seriously as possible. Tom Martin from The Express.
Hi, thank you, First Minister. Again, can I just return to the issue of students? Obviously, you'll probably be aware of all the concern over the weekend, but again, on this issue of money, a lot of parents and students feel as if they've been treated like cash cows in getting back to university and getting into the halls. How do you address those concerns?
I don't think that's the case, but universities should, in the way that they deal with this and the flexibilities they show students, and I would extend that to accommodation providers where accommodation has been provided by other companies or organisations, should recognise in the decisions that they're taking that greater flexibility is required here. And I think Glasgow University, as I said earlier on, has shown a great deal of positive initiative in doing exactly that. And last question today is David Ball from The Herald.
Thank you, First Minister. The decision to reopen schools full-time was influenced by the success in suppressing the virus over the summer. With a trend of rising cases, the EIS has called for triggers to be set out where schools could close on a local or national level and where blended learning plans need to be rolled out. Can I ask how confident you are that we're at safe levels for schools to remain open full-time? And what would it take for blended learning plans to be needed?
Yes, I think schools are safe to be open full-time. I think it's really important that schools are open full-time. And actually, that's one of the reasons why we're asking the rest of us to live with greater restrictions on our freedoms, so that we do manage in other ways to try to keep the virus at a level where schools can open full-time. As I said, I think in one of the statements I made last week, with an infectious virus, a global pandemic of an infectious virus that as yet we have no vaccine for, there is no country that can have 100% normality. So everything we want to say, that's a priority to stay open, we have to effectively make that possible by accepting restrictions somewhere else. We've chosen as one of our priorities keeping schools open, and that's why we're having to live with restrictions to try to make sure that those trade-offs allow that to happen. Local authorities have flexibility. There are in, I think, the Western Isles today, some schools that will be closed over the next 3 days because of cases there, and they've decided on a precautionary basis to do that while contact tracing happens. So proportionate precautionary decisions will be taken. And of course, we will always require to have a blended learning contingency in place, because none of us unfortunately know exactly what the winter period will hold in store for us. But the more we can collectively try to keep the virus under control, the more chance we've got of keeping schools open, which I think is important for not just the education, but the health and well-being and future prospects of young people across the country. Gregor, do you want to add anything?
Yeah, my view very strongly just now is that it remains safe for schools to be open and to be teaching education in person just now. It's something that I feel very important that we make sure that we protect the ability for particularly some of our more vulnerable children, to have that in-person education, and that their life chances are secured as strongly as possible. We know from the evidence that actually that in-person education is much better for them in the longer term, and that actually it helps to reduce some of the inequalities that we see within society as well. So anything that we can do as a country to try to make sure that we protect the ability for that education to continue to take place on a face-to-face basis, we should try to embrace just now.
Thanks, Gregor. That concludes the questions for today. Thanks as always to journalists for joining us. My thanks to Jill for the BSL interpretation, and to Gregor for joining me today, and thank you to all of you for watching. Please, I know these restrictions are not pleasant for any of us, and I think particularly after a weekend when we've all been unable to see our families and friends in the normal ways that we all like to take for granted, it probably feels even more so that we're all being asked to make big sacrifices right now. But please keep doing it, because it is about bringing this virus back under control. The sooner we do that, and we know we can do it because we've done it before, the sooner we can get back to, if not 100% normality, then more normality in our lives than we have right now. So my deep, grateful thanks to all of you for continuing to do the right things. Please spread the word to everybody you know. Remember to stick to the rules on household gatherings. Don't visit other people's houses right now. Stick to the limits when you're outdoors or in public indoor places. Work from home if you can. Download the protect.scot app and stick to facts, because that helps all of us minimise the risk of transmission. So it is as important today as it's ever been. Face coverings, avoiding crowded places, cleaning hands, cleaning hard surfaces, keeping a 2-metre distance, and self-isolating and getting a test if you have any of the symptoms of COVID, which, to remind you, is a fever, a new cough, or a loss of or change in your sense of taste or smell. Thanks very much for joining us. I'll be back here tomorrow at 12:15 for tomorrow's update. Thanks for now.